as I mentioned before, it's a real privilege to have Dr. Chaand Nagpaul to open our conference as our first keynote speaker. He has many accolades, including receiving a CBE from the Queen for his services to primary care. He's also a fellow of the Royal College of General Practitioners. But as we've mentioned, he has shattered glass ceilings for many doctors out there and has really transformed the BMA. He is the first BAME doctor to become chair of the British Medical Association. He's also been chair of the GP committee for the BMA, but really we invited him here today because his story is so inspiring. He understands the issues that many of you face when you come and work here in the UK, and we felt that there would be no one better to introduce you to working in the NHS, as well as highlight what opportunities you have when you come here to work in the NHS. And really, he is a true example, a true inspiration of what you can achieve despite your background in the NHS. So without further ado, I'd like to introduce Dr. Chaand Nagpaul to open our conference for us. Thank you, Chaand. It's a pleasure to have you here.
Good morning. Can everyone see and hear me, the first thing? So you can see me now, yes?
Yes, Chaand, we can. Okay. Thank you.
Right, okay, so a really good morning. I am absolutely excited and delighted to have this opportunity to speak to an international delegates of IMGs, those who are working here and those who want to come and work in the UK. And thank you for that very kind introduction, Pooja. I have grown up with IMG doctors. I was born abroad, but I've had my career has been spent being inspired by IMG doctors. I'll come on to that later. I am chair of the British Medical Association Council. And the BMA, as you heard from Pooja, is a representative body. We represent over 160,000 doctors of all specialties, of all disciplines, whether you are a medical student, whether you are a junior doctor, a GP, a hospital doctor, public health doctor, an academic, you name it, we represent every type of doctor in the UK. And not only do we represent you as a trade union, negotiate your contract, support you as a trade union, we're also a professional association. That means that if you have an interest in medical ethics, in any scientific matters, international matters, we also provide support, but also your ability to contribute to the professional work of what it means to be a doctor. So I'm going to today talk about my personal priority and the BMA's priority for supporting and valuing IMGs in the NHS, not just in terms of what the BMA is doing, but our lobbying so that the UK as a nation can properly value and support the essential role of international doctors who come and work within the UK. So we know that IMGs make up around 27.5% of the UK medical workforce. That's a significant proportion. And what I'm showing on this graph is in recent years, the proportion of IMGs in the NHS has been steadily increasing. In fact, in 2020, there was a 13.1% increase in international medical graduates working in the NHS. You know, that's about 73,000 doctors. That's about 23,000 also from the EEA. So a very essential part of the workforce. And the numbers of IMGs that are coming to the UK is increasing. In fact, we have almost 2 times as many doctors who are international graduates registering with the GMC than new UK graduates. So in 2019 to 2020, 62% of new registrants on the GMC register were IMGs, 6% from the European Union, and 32% from the UK. So the role of IMGs is becoming more and more important within the NHS. Now, you probably know that the UK is under-doctored. We have fewer doctors per 1,000 patients compared to most of our European counterparts. And this graph just shows the UK is at the bottom of this list in terms of the numbers of doctors. So we, of course, really do need, and we depend upon, international medical graduates. So you really are a very valued and necessary resource working within the NHS, and we need IMGs to actually, for the NHS to function. And we, of course, have a government policy for international recruitment, but I must say ethical recruitment, and there are standards that we have in terms of not wanting nations to themselves, other nations in the world, to become underdoctored. And remember, of course, many IMGs, and some of you as well, will be coming here to train, and you'll go back to your countries, but in fact, coming to the UK offers opportunity for training in institutions of excellence, acquiring skills that the UK has to offer. But whilst you're training, we are gaining in the UK with the work you provide and the patients you treat. So there is synergy in many of the international graduates who come here, even for a defined period of time. Now, it's worth mentioning that Brexit and the UK leaving the EU will have an impact, because doctors from the EU will then also have new hurdles in coming to the UK. They'll need to have a visa. They'll need to pass certain requirements which they currently don't have, and we may see, therefore, a drop in number of European doctors coming here. We may therefore need to rely even more on doctors from other nations, IMGs from other areas, to come to the NHS. So it's just something to factor in terms of our workforce planning. Now, why did IMGs come to the UK? Well, the British Medical Journal did a very good study on this, and the two main reasons are: one, career development. Again, as I've said, the UK offers excellent opportunities for career development, great internationally renowned institutes that can provide you with training, education, learning, and skills. And the other is the healthcare system itself. We are proud, I am proud, of working in a system that is providing care free at the point of delivery, without any considerations on anyone being able to afford healthcare, where there is fairness in the delivery of healthcare, equity, and it's a comprehensive healthcare system. And so these are factors that draw doctors from around the world to come to work in our NHS. Now, having said that, we also know that doctors coming from abroad do face challenges coming to the UK. We know that the actual immigration process has in the past been quite inflexible, complex, and expensive. We know that coming to another country is challenging. It is relocating to another country is challenging. It's even more challenging because so many IMG doctors will initially, or maybe they will be coming only by themselves, leaving their families, and they're having to contend with the whole issues of opening a bank account, housing, employment advice. The NHS is a challenging place to work. I think you all know that. Medicine is challenging, and the NHS has its additional challenges, and of course it has a culture. Every nation has its own culture of how its health service operates, and so you're not just adjusting to a new country, you're adjusting to a new healthcare culture and the way in which the healthcare system operates. And there will be cultural differences in the way the NHS operates to the way the healthcare system in many of the other countries of the world operates. So you are having to adjust quite considerably, and that comes on to the next issue, which is about induction. And one of the real I think challenges for us is that the induction to the NHS, in our view at the British Medical Association, is inadequate at the moment, and we're campaigning for real change in this regard. There is a half-day, it's not compulsory, but a half-day induction program by the General Medical Council, which is really highly regarded, but it is only half a day. There are some trusts and some royal colleges who offer additional induction, which is good, but it's unfortunately not mainstream. And it's more than induction. There isn't adequate ongoing support in the NHS once you join. So I'm highlighting these limitations, but I also want to offer you hope, because these issues are being campaigned at the highest level by the British Medical Association and others. And I'm really hoping we're going to see some change very shortly in the way we provide support for those of you who come to the UK to work. There's a really great example in other countries. For example, in New Zealand, they have what they call an orientation and induction program. So they understand that this isn't about coming to another country, having a crash course in how the system works, but it's an ongoing process over a year, over 2 years, in how you adjust. And it's a very phased introduction program. It's a sort of arrangement that I hope that the NHS will be offering in the future. What we don't want is for doctors to come here and within a short space of time, within a week, to actually be filling a rota gap in a hospital on call. That's just the wrong way to introduce a doctor from abroad into our National Health Service. So I just want to say that there are these challenges, and it's something that I and the BMA and others are determined to make improvements on. And when there was a survey done by the British Medical Journal, this was the #1 issue for IMGs, that they wanted better induction. They wanted to have better support, ongoing support, mentorship. And these are all issues that are at the forefront of our lobbying with the government to make a difference. And I'll come on to that later as to why the government really does need to be providing this support for our international medical graduates. There are additional challenges. I want to just be open because it's something that it's important to recognize, that there are additional challenges for IMGs when they work in the National Health Service. But I also want to make sure that you understand that we're going to be challenging and making sure that these constraints are addressed. Black and Asian and minority ethnic doctors do face additional challenges in terms of greater levels of reported bullying, harassment, and undermining in our nation, unfortunately. They've also, in the BMA's own work and surveys, said that they feel twice as likely not to raise concerns. They don't feel as confident in raising concerns about safety or issues of problems they experience in the workplace. And part of that is that they feel perhaps it may result in negative repercussions on career development. That's what we found in our COVID-19 pandemic surveys. And this is unacceptable, and this needs to change. And it's something that I and the BMA and others are determined needs to be addressed. But I think it's important to be open that there are these additional challenges and poor experience experienced by some IMG doctors. But there's been this has really been something that's been publicized a lot, a huge amount of attention paid to this in the last year or two. And this really is about the fact that many IMGs, when they come here, are not being included. They feel more isolated, and therefore that affects their performance, especially if they feel that they're under pressure, not supported, and in fact may feel treated unequally. We know that if doctors are feeling, any doctor feels under pressure, feels bullied or harassed, we know their performance will suffer. They won't be able to work their best. It affects there's greater likelihood of medical error, and those may in part collectively influence another unfortunate statistic, which is IMG doctors are less likely to pass postgraduate exams than white doctors in the UK. And also there are, unfortunately, more than twice the rate of disciplinary referrals for doctors of a Black and Asian ethnic minority background. And IMGs, of course, form a large part of that. Now, those challenges and those inequalities are an absolute spur for me and others to make sure they are addressed. And I want to again just reiterate that we now know that the differential attainment of IMGs, the fact that IMGs do less well, about 23% lower pass rate for postgraduate exams, is not due to a lack of ability. Those of you on this conference, are highly skilled, highly talented. You've achieved plenty in your own nations. There's absolutely no reason why you are in any way lesser working in our NHS. So the system is actually not allowing many doctors to flourish and be their best, and it's something we're determined to change, and I'll come on to how that change must occur. We also know that the disproportionate referrals, are twice as many referrals for disciplinary processes amongst BAME and IMG doctors, is not due to factors that relate to the doctor necessarily. They are about the system that, as I said, means that many IMGs feel less supported, they feel under pressure, they feel less able to speak out and fend for themselves. And these are reasons why I will come on to later. It's really important to have the backing of a trade union, such as the British Medical Association, to be your advocate, to represent you, to fight for you. And I've spoken to many IMGs who have described experiences of inequality. And when I've asked them whether they've been a member of the trade union, they haven't. They've come from countries where the trade union movement may not have been so obvious, but actually that's when you need a trade union to support you and advocate for you. So it's one of the benefits of being protected with a trade union. Now, I want to say there are some very good examples of good practice. For example, the Royal College of Psychiatrists has a mentoring and training scheme where they make contact with international medical graduates who want to pursue a career in psychiatry, and they provide mentorship well beyond the first induction. They provide it ongoing. In Scotland, they've just introduced a buddying system for IMGs, and Health Education England are providing some targeted support for GPs of who've come from abroad. You know, I just want to say, coming back to the orientation, in New Zealand, they even collect an IMG from the airport. It's really welcoming, and they will provide orientation for months on, and they'll even help with housing. That's what I would like the NHS to be offering our international medical graduates when they land in the UK. And I think that this shouldn't be an aspiration. This needs to become a reality that we will be campaigning for. Now, I'm a GP, and I just want to say that let's not forget, we talk a lot about hospitals, but many of you will be coming here to work in general practice. And general practice, I would have to say, you know, owes its existence to international medical graduates, and as a GP, I've been inspired by doctors who have come here many decades ago. They worked in areas that no one else wanted to work in. They occupied an end of terraced house. They put a nameplate on, and they built up practices from scratch to now, you know, large health centers offering a range of services, providing services to the community now for decades. And this is the contribution of international medical graduates who have, in effect, been termed the architects or migrant architects of our health service. But again, we know that IMGs, doctors from a BAME background, are often working in the most deprived and challenging areas. They're often working in smaller practices. They've not been supported as much over the years, and they also do again suffer unequal sort of judgments on their practice through a regulator called the CQC. Again, these are issues that are at the forefront of our efforts at the British Medical Association to address, because really we should be celebrating the efforts of all of our international medical graduates who've actually, as I've said, really been the architects of the NHS since its inception. Now, this slide is a slide which is a very sad slide. These are not all, but these are many of the faces of the doctors who have passed, who've lost their lives with COVID-19. And as you can see from this slide, the over 90% come from a Black, Asian, and ethnic minority background, and the vast majority of those are from an international medical graduates. These are doctors who traveled from all parts of the globe to come to our National Health Service to save the lives of others, but who unfortunately paid the ultimate sacrifice. And I think that there is absolutely no doubt that this nation owes a debt of gratitude to the contribution of our international medical graduates. And I do think that there has been now, you know, unequivocal recognition of the absolute central role of IMGs that have worked in the NHS throughout this pandemic and who continue to work in our National Health Service and will do so throughout until the pandemic ends and thereafter in our health service. So it really has been a very pivotal year in recognizing the worth of our international medical graduates within the NHS. And you know, the British Medical Association, as I said, is here to lobby, to represent doctors. And what we did when it came to the fact that the first 10 doctors back in April who died were all from a BAME background, well, we called it out. I was representing the BMA, and we were the first organization to, in the media on the 10th of April, I was featured in a major newspaper, The Guardian, really calling out that the government needed to act to protect our Black, Asian and minority ethnic doctors in the NHS and those from overseas. And I was very, very emphatic that the NHS had to really value and support and prevent our IMGs and ethnic minority doctors from harm from this virus. And we campaigned and lobbied for risk assessments so that those doctors at highest risk could be redeployed, could perhaps do remote work, or in fact work from home. And that was achieved with a lot of hard work from us, but it took a bit of time, longer than it should. But it gives you an idea of the sort of work a trade union does on behalf of its members. We also devised a risk assessment tool which was employed in hospitals, GP practices, and amongst BAME doctors themselves that could give them an idea whether they were in a high risk, and if they were in a high risk, for their employer to protect them from doing perhaps front-facing COVID work. We've advocated strongly for IMGs during the pandemic. I wrote to the Home Secretary, Priti Patel, back in April, calling for the health surcharge to end for IMGs, calling for doctors to be able to switch sponsors and do that automatically without applying for another visa, and for indefinite leave to remain in the tragic circumstance for dependents if doctors died during the pandemic. In June, I wrote again to the Home Secretary asking for extensions of visas for doctors who were stranded here for PLAB exams. I also wrote to the Prime Minister last month in July, again asking for further support for indefinite leave to remain for IMGs who were working in the NHS on a route to permanent settlement. So we're certainly at the highest levels of government lobbying for change for IMGs. This is just a small selection of some of the media coverage that the British Medical Association has had for IMGs. I have to say it's a tiny selection. Every time that I have opportunity to speak on a television program, I will talk about IMGs. I will remind the public, the government, policymakers of the immense value and importance of international medical graduates in the NHS. I gave evidence to the Parliamentary Health Select Committee just a few weeks ago on pressures in the NHS and doctor burnout. And again, I made specific mention of the need for our National Health Service to properly support and value international medical graduates. It's an absolute priority of mine personally, as well as of course for the British Medical Association. And during the COVID pandemic, what the BMA has lobbied alongside, I should add, other representative organizations for BAME groups, we lobbied to allow flexibility to work additional hours for IMGs without compromising immigration. That was secured in March 2020. We asked for the ability for doctors to work at different NHS sites rather than a single site as per their sponsorship visa. That was achieved in May. We applied for indefinite leave to remain for dependents. That was achieved in May 2020. We've been lobbying hard for exemption from the health surcharge. We thought that was illogical, that any doctor working in the NHS should be paying to use the NHS. That was achieved in May. We wanted to make sure that doctors here who were stranded with regards to sitting the PLAB exam and stranded because of the delays in being able to sit that exam during COVID should allow extension. That was achieved in September. And we did we also had similar arrangements to support GP trainees. That was achieved in August. And we've also secured most recently, after lobbying a continuation of automatic visa extensions for doctors whose visas expired on the 1st of October. So a lot of changes have taken place during the COVID pandemic through the lobbying of the BMA as well as others. And we've lobbied for IMGs well before the COVID pandemic, starting in, as long ago as 2015, when IMGs in the UK wanted to go and help out in the Ebola crisis. Well, we secured that they could without compromising their immigration status. The BMA lobbied also for an exemption to the health surcharge right from its inception. Last year, we lobbied for an end of what was called the Tier 2 cap that restricted the number of international medical graduates who could come to the UK. And we also, in 2019, last year, lobbied, and now all doctors from abroad are in the shortage occupation list, which allows greater numbers to come to the UK. We've also lobbied and succeeded in reducing the costs of coming to the UK in terms of the immigration system. And you now have, as of January 21, a different immigration system that applies on highly skilled routes where the cost of coming here, the visa cost, has been reduced, the health surcharge has gone, and there is a streamlined sponsorship process for employers. So there are certainly improvements in the immigration process for those of you who will be coming here after 2021. We will continue to lobby for further changes, but it is improved. I should add, for the EEA doctors, it will be more difficult because they will not have freedom to come here in the same way. So that is just one factor to bear in mind. So I said that this is a priority for the BMA and that 2/3 of IMGs are not members of a trade union. And again, I just want to reiterate that given that there are higher rates of difficulties in the workplace in terms of unequal treatment, issues around workplace negative experiences, you need an advocate for support, and the BMA is here for you. So please do consider availing of that support. And many IMGs, as I said, have told me they didn't realize the BMA would be there for you. You can call us if you have a problem with regards to feeling you've had an unequal treatment in terms of a rota, not being given annual leave when you needed to, and so forth, right through to issues of discrimination. We are here for you. We also allow you to have your voice heard. And what we have started, and what I have personally supported, is the setting up of a dedicated IMG workstream in the BMA so that we provide absolute specific lobbying and support for IMGs. This workstream means that now every single committee in the BMA, whether it's the GPs committee, junior doctors committee, consultants committee, staff associate specialist committee, all of them now have an IMG champion, an elected lead, looking at the specific needs for IMGs. We've also looked at our member employment support. Our member employment support allows you to call us at the moment during COVID 24 hours a day if you have a problem in your workplace. And we've looked at this so that the support we offer is tailored much more to the needs of international medical graduates. We offer a contract checking service for IMGs if they arrive in the UK or before they arrive, if you're a member, to give you advice on whether your contract is fair to you, if it's got the right terms and conditions. And we've now launched also a dedicated IMG newsletter that goes out to IMGs. So we are absolutely doing, and we will continue to do much more on the support to IMGs. So we've got this whole work stream and many IMG champions. We also want to celebrate the fantastic work of international medical graduates. And so we have publications in the BMJ, we have website articles, we have a publication called the Doctor Magazine. And you've just got here some of the examples of doctors who've come here, and we want to share their stories, their successes of just how much they have done in our health service. And I'm really proud to see the fantastic achievements of so many doctors from abroad and what they have actually done, the talent they brought to the health service. Again, just reiterating the support we offer. We offer immigration advice support for any of you who are coming here. We have a toolkit that you can make use of that gives you information on adjusting to the UK, issues around the ethics of the NHS and so forth, how to set up a new life, right down to even getting a new bank account. We provide enormous learning material as part of the membership of the BMA. You get the British Medical Journal. You have access to many learning CPD modules as well, which will be some of which are tailored to you as an IMG. I said that we check your contracts to make sure they're fair to you and they have the right terms and conditions. We also provide tailored support for the sort of career you may wish to embark on in the UK. So we are here for you when you need. I told you we have a support line. At the moment, it's 24 hours a day. We have employment advisors that are trained in equality and discrimination issues. We have industrial relations officers who are out in the field to support you in your local area if you're having difficulties in your hospital or your GP practice. We provide confidential, free of charge well-being support. We have a 24-hour counselling helpline if you're facing difficulties, if it's affecting you, if you're away from your family, which many of you will be, and you need support, we can provide that support 24 hours a day, a confidential support helpline. We also offer one-off grants if people are facing particular financial difficulties. We're here for your well-being. But I want to finish by not just talking about supporting the difficulties of IMGs coming here. I want to actually finish by saying that actually what we should be doing, what I do and what I want others to do in the NHS, government, etc., is to think of IMGs in terms of the value that they bring to our health service. That in fact, we as a health service are all the richer by having doctors who bring diverse experience, high talent, skills, expertise, looking after conditions we don't look after here, but you can actually bring that expertise to our health service. And I want the focus to be one of celebrating and value, not just one of supporting difficulties. Because actually, what I've told the government repeatedly is that if you value, support, and allow international medical graduates to be their best, to achieve their best, to reach the highest levels of the NHS, it is the NHS that will benefit. We will become a better health service. We will provide better care for patients. And in fact, we will become a much stronger nation as a health service. So that's really the message that has to be the message that goes out to government. So 2021 has to be, in my view, the year of IMGs, the year of valuing the essential contribution of IMGs in our NHS. And COVID-19, I think, has shone a spotlight and made it abundantly clear that IMGs are absolutely central to the contribution of work in the NHS. Their worth has been seen for all have seen it in 2020. We not just owe a debt of gratitude, but we do need to recognise the immense role of IMGs in day-to-day in the NHS, including as we speak today. We also know that with workforce shortages and with Brexit, the UK has to be an attractive place for IMGs. I've told the government that in fact IMGs, many of you from abroad, will be looking at the UK, but you'll also be looking at other parts of the world. And I want them to be able to tell you that come to the UK, we will welcome you, we will look after you. So make it attractive. And that needs cultural transformation, a culture where the NHS becomes a welcoming healthcare system and creates an environment that is inclusive, supportive. It values diversity and the contribution of our international medical graduates. Those of you who come here for training and go back, those of you who want to come and stay here and develop your career here in a permanent way. So that's what 2021 needs to be. There are some specifics that we want to achieve in 2021. One, we want to achieve indefinite leave to remain for all international doctors on a path of settlement. We believe that the COVID pandemic, just has highlighted how that is absolutely the right thing to do. So we're going to be campaigning for that. We want to see, as I said earlier, a comprehensive induction system, but an orientation system that makes you feel that you're able to work in the NHS in a graded and phased way, where you can become familiar and you can feel that you understand and feel part of the NHS and the UK system as you work here. We want to make sure that there's mentoring and peer support, so you don't just come here, have a little bit of training, and then you're left to get on with it. That it's a continued level of support and an NHS that really more broadly values diversity. But more than that, we want to make sure that if these things are being done, we can measure performance. So we're calling for systematic monitoring and measurement of progress against those changes that we want to see happen. So finally, a huge thank you. And I want to personally thank you and also thank you on behalf of the British Medical Association for those IMGs that work in our NHS and for those of you who want to come here. And I want to tell you that if I ask myself, what has given me the greatest inspiration as a doctor that actually comes from Indian origin, I have to say it's the IMGs who work in our health service. From a young age, that when I came to the UK, I do know a lot of IMGs. I come from a community that has many IMGs. I have been inspired by just the amazing work, dedication, the work ethic, diligence, conscientiousness, and really the humbleness and understated nature of so many of our IMGs who have been heroic in the work they have contributed to our health service. They have been an inspiration to me, and I want to thank all of you who want to work in our NHS and who are working as IMGs, and we are here to support you. Thank you so much for giving me the opportunity to speak. Thank you so much for listening.
Hi, Chaand, thank you so much. That was a really useful talk. And we can see from the questions and comments coming in, people were really loving what you were saying and they're resonating with what you're saying as well. So thank you so much. We've had so many questions come in actually, and we're trying to screen out the most commonly asked ones. So if you've got a few minutes, Chaand, can we ask a couple of questions that the audience have posed? Fantastic. So one of the questions that came in a couple of times is GMC registration needed to become a member of the BMA?
No, I don't think it is, because we have retired doctors who may not be registered. So with the GMC, no. And in fact, can I say one of the things that I'm hoping that the BMA can do is offer what we call overseas membership, affiliate membership at low cost. Because what I would like so much is for doctors before they come to the UK, not registered with the GMC, to have the benefits of us supporting you right from the time you think about coming to the UK. So no, I think the answer is no. You don't have to be.
Pooja, you had a couple, I think.
Yes. So Chaand, a few people have asked, is there any way to get full access to full membership benefits? Because apparently you need to have a UK bank account to have full membership details. I don't know whether it's something you can answer, or whether it's something that you need to take back. But a lot of people are saying that they have been a BMA member, but they can't access full membership benefits because they need to show details of a UK bank account.
Okay, so I didn't know about that. I'll take that away. And can I also make an offer that if any of you who are at this conference have such questions, if you don't mind, Pooja, I'm happy through a conduit through yourselves to have those questions sent to the BMA. What I want to make sure of is that the BMA should continue improving our support we provide IMGs. So please, I'll take that question away, but any of you who have questions, please email them in. And in fact, Pooja, maybe we can even give you an email address that the BMA can receive such questions directly.
Bro, absolutely, more than happy to do that, Chaand. And one important point that I know you are familiar with that's been highlighted is that a lot of our attendees today have mentioned that they don't get access to inductions when they come and work here in the UK. And you did mention it in your talk, but they're saying, how do we get access to inductions? We come here to work in the UK and immediately we're put onto the shop floor to start working. So how do they find out about getting inductions?
So the first thing, that the only induction that's sort of officially available to all is the GMC. The GMC offers an induction. I have to say that it has very high levels of satisfaction. So it's obviously a worthwhile induction. The trouble is it's only half a day. So I would say two things. One, if you are being asked to work without induction, tell us in the BMA and we will advocate for you. We will fight for you to make sure you are not put in an unfair position. It's not fair to you. It's not fair to patients, and we will take that up on your behalf. Secondly, if you are a member of a Royal College, some of them offer absolutely excellent induction. I mentioned the Royal College of Psychiatrists as an example, but do tell us. But the third thing is, I don't want this to continue. The NHS, the government has to sort this out. But in the meantime, tell us and we will advocate on your behalf. You should not be working if you're not in a prepared state to work in the NHS.
Brilliant. And one final question. Are doctors able to access their BMA membership before coming here to the UK?
Yes, I mean, so you can be. We have got members who are abroad, and they access the benefits. But really, the highest benefits for the BMA is the trade union support. So, for example, if you have a difficulty at work, if you feel you've been treated unfairly, if you feel that you weren't given a post that you deserved, any workplace issue, then that, of course, is going to be of value when you're working here. But if you're abroad and you're thinking of coming here, yes, you can be a member of the BMA. And what I'm hoping we can offer is, as I said, an affiliate overseas membership to give you extra support. But we offer support before you come here. We can check the contract. So if you are coming to the UK and you've been offered a job, we can check your contract. And I just want to mention one small thing from the last question. It's not just the BMA, your hospital trust, or if you're going to become a GP, your employer should also offer induction. And if they are not offering induction and they expect you to work, without any of that, you should not accept that, and we will support you. So I just want to be sure that you understand that your employer has a duty as well to induct you.
Brilliant. And everyone can clearly see why it was so important to get Chaand on board this morning for this conference. Now, before Chaand leaves, I think it's important to do one final poll to see how useful you found his talk. So let's just see. Many of you are asking how to participate in the poll. We want to ask you, are you now more likely to consider joining the BMA, having heard what Chaand has said? Yeah, great, guys. We've currently got around 730 of you on. Nearly half of you have voted. Just another 10 seconds. If you can, click on the option, that would be great. And we'll share the results. Wow, so you can see the impact you've had, Chaand. So 98% of them are now considering joining the BMA thanks to the information you've provided. So lots of messages of thanks, Chaand, for the great talk you've done. I'll try and pass on those messages. People are very grateful for the work you've done to support IMG doctors. And as we said before, Chaand truly does want to make a difference to IMG doctors' working lives. Please feel free to click on the link the BMA have provided, which we've shared in the chat, and it's also in the handouts. But thank you ever so much, Chaand, for coming this morning and giving that talk.
Thank you.